Hello, I'm Tammy Sue, the Director of Operations with Faith Hospice, and I'm joined by Ben. He is our West Team Manager, and we're going to talk to you about what we call our Hospice 101, which is our basics of hospice, the benefits and services, and also a little bit about hospice and how that compares with palliative care.
Yeah, thanks, Tammy Sue. I think we'll get started by reviewing just a definition of what exactly palliative care is. I found this from the Mayo Clinic. I don't think there's exactly a dictionary definition of what it is, but I felt like this was a good summary to give you a good understanding of that. They state it as specialized medical care that focuses on providing patients relief from pain and other symptoms of a serious illness. No matter the diagnosis or stage of disease, palliative care teams aim to improve the quality of life for both patients and their families. So that definition was really helpful because as I was reading that, you might say, well, that sounds a lot like what I know that hospice does, and that's true. So I'd say there's a lot of confusion about, well, what's the difference between hospice and palliative care, because they're both very similar to each other. So I had found this graphic too that helped kind of show some of the things that were different and some of the things they shared in common. And as you could hear too from the definition, hospice does exactly that. Hospice is a type of palliative care where the main focus is on improving someone's quality of life at the end of life. So I'd say that's probably one of the biggest distinctions from just palliative care, is that palliative care is often received when they have a serious illness, but they're also pursuing curative, sometimes referred to as an aggressive treatment for that illness. And hospice provides a lot more involvement and many benefits over palliative care, but the person who has hospice has to qualify for hospice physically and both kind of from a philosophical standpoint too. So Tammy Sue will talk a little bit about that. And for the rest of the presentation, it'll really be an overview of what exactly is hospice care.
So Medicare has a hospice benefit, and private insurances do pretty much follow the Medicare guidelines. So you hear me say Medicare quite a bit, but that would also imply the coverage for private insurances, though we would always let you know what the differences are once somebody did sign up for hospice. So with that Medicare hospice benefit, for that to kick in, a couple things. So physically, two doctors would have to say that if someone were to continue the way they were, that they could have 6 months or less. That doesn't mean you can only have hospice for 6 months. It doesn't mean that you can't come off of hospice, back on hospice. It's just a best guess. We are people, we're not machines. So the doctors just have to go off of that. The other thing is that Medicare doesn't want you to be on a curative treatment track and a comfort track at the same time, usually one or the other. So you want to be either done with treatment, meaning whatever's offered you don't want, or there is nothing further to be done, no options. So those are two things physically to meet that eligibility. And then emotionally, you need to be ready for hospice. So usually that means you don't want any further hospitalizations. You want to be kept comfortable wherever it is that you call home. Can be the hospital for a brief period of time, long-term care facility or home with family caregivers, whatever that might be. And generally, though not always, if your heart were to quit beating or you were to stop breathing, you would not want those restarted. That's not a must. A lot of people come on to hospice still wanting that done. And so So those are two areas to think about as far as whether you're ready for hospice or not, and then that hospice benefit can kick in.
So I had mentioned before, one of the big benefits from moving to from palliative care to hospice are the additional services that you get with hospice. So in both cases, you do get a team who's working to try to improve your quality of life or maintain your quality of life, limit the side effects of maybe the treatment you're receiving, and just provide you overall comfort and relief from pain during that process. With hospice, we do a lot of the same things, but there's a lot of additional benefits on top of that as well. One of the benefits is the 24/7 availability of hospice. Do want to clarify, because some people end up hearing 24/7 care, and that's not necessarily what hospice provides. We're available 24/7, meaning that you'd have a number to call if there was a crisis or you had a question, or even if you're just wondering, hey, I can't remember when the aid is coming today. It's one single number that you end up calling, and you have access to that 24/7. The next piece of hospice that I want to talk about is the primary caregiver. So just like I had mentioned, when you sign on to hospice, you won't have a nurse there 24/7. You won't have an aide there, at least provided under the hospice benefit, for 12 or 8 hours a day. But you end up being the primary caregiver of that individual. So a lot of times that end up being a family member who's caring for the patient. Sometimes it's a friend, sometimes it's just a neighbor, when that patient doesn't have much of a support system outside of family. So that person would end up being the primary caregiver. And what hospice ends up doing is we come alongside that primary caregiver, provide them training and education in order to do that job better. But you also have access to a team, so should you need additional support and help along the way. The team for hospice includes the physicians. Our physicians end up making home visits when it's requested or beneficial, which is a great benefit. As your disease progresses, and certainly as you're within that 6-month window, for a lot of our patients, that means it's harder and harder for them to get out of the home. So one great benefit for hospice care is that it's a service that goes to you. So that would include visits from our physician. The other person that's involved in the care is the registered nurse, and they're the case manager of the team. And so they end up going maybe once a week. They go at least once every 2 weeks, but sometimes they go out and visit the patient as often as 2, 3, or 4 times during a week, just based on the needs and what's happening. So that's kind of what all the other team members end up basing it off of. It's very needs-based. Social workers part of that too, providing a lot of education on the end of life to the patient or family, just because there's a lot of comfort in knowing what to expect or what's quote unquote normal during that process. And everybody kind of goes through that a little bit differently too. And so it's nice to have a team there providing some support through something that might be quite new to you as an experience that you're going through. So social workers, I'll back up and let you know the nurses do a lot of the symptom management and care. So they're focusing a lot on that physical part of that disease process, where the social workers, they focus a lot more on that emotional part of it, as well as some of the practical resources and supports that might be helpful to the patient or family in order to maybe keep them at home or find a different placement that might be more appropriate depending on the situation. The chaplains, they of course provide spiritual care at the end of life. We're a faith-based organization, but they're not there to evangelize to people. The spiritual support that someone's looking for could look very different from one patient to the next. So they're there to help support that individual with what would be most beneficial to them. Our home health aides, I really like talking about them because that's a huge benefit once a person's on hospice. So again, you're not going to have a home health aide through hospice being there to take care of mom or dad for 6 or 8 hours a day. They do go out for about an hour at a time, and that could range anywhere from once a week to maybe 3 or 4 times a week on average for most of our patients. The huge benefit is not only the care that they're providing while they're there with the patient, but it's also the training that they provide the caregivers. So a lot of people haven't had that role as a caregiver, and these hospice aides do this for 40 hours a week for years sometimes, and they've picked up a lot of tips and tricks on how to do things easier. And a lot of times the caregivers will say, wow, I was doing that the hard way. And the aide will say, yeah, you were, and this is easier. So it's great to be able to have that partnership with the aide that comes out. Our volunteer services over the past year, it's looked a little bit different, much like other areas, but a lot of times hospice will provide volunteers to go out and provide some companionship with a patient, whether they're at home or in a facility. We have volunteers that play music. We have volunteers that they're more geared towards arts and crafts, and we have some patients that really benefit from those things too. So that, again, is another extra benefit from hospice that can be really helpful and welcome. And then lastly is bereavement. We save this one for last because a lot of times the bereavement benefit to hospice comes after your loved one has passed away. So they are available to family or friends of that individual. And that's a service that can be used for up to a year after someone passes away. They do a lot of counseling, whether that's in groups or individually, because a lot of people have different preferences on that too. So that bereavement piece is one of those pieces that some people forget about, because a lot of times that comes in after your loved one had passed away.
Yeah, and just to clarify with what Ben had said about the case managers, we do also have extended care staff that work all the after hours and on the weekends, because a lot of times when you need somebody, it's 3 a.m. on a Sunday morning on the weekend, and we want people to call during those times when something's happening. We don't want them to wait till 8 the next day or the next business day. So like Ben said, if you have a question and just want to talk to somebody, that's fine too. But they are also very happy to make visits on those after hours to help guide through new medications or help with any symptoms that may come up in the middle of the night as well. The other part of that Medicare hospice benefit is medications. All the pain, well, I guess all the pain and comfort medications are covered. In addition, medications that are specific to the hospice diagnosis would also be a piece of that. So if you're on for a breathing issue and that's your diagnosis that has led you to qualify for hospice, then those medications would be covered under that hospice benefit as well. Medications that aren't covered under that are usually covered the way you've been covering them before, and will help you navigate those pieces. Medications often will come right to your door, or we can get them covered or filled, locally as well. Equipment and supplies. So most things we can rent, wheelchairs, hospital beds, oxygen, bedside commodes, walkers, those kind of things as needed are supplied under that benefit, as well as incontinence supplies, dressing supplies, maybe some skincare things. So I always request that patients' families ask their hospice team, their nurse, if it's something that we supply or not before you go out to buy something, so you're not unnecessarily spending extra money. The other thing that we get a lot of questions about are So let's say I have another appointment with a physician, or I have this procedure coming up, or what about hydration? That's always a big question with hospice, or blood transfusions or lab work. These things are super individualized on as far as how they can benefit each person individually. So to say that we don't do any of this would not be true. To say that this is covered with every individual would also not be true. So it's always best to sit down with a hospice team member or a nurse and get their input on what is going on specifically with you. So I have had lots of patients that have been on hydration and it has benefited them. And then at some point, with a body decline, then it doesn't. It's more detrimental than it is beneficial as far as affecting breathing and pain. So that's just one example. But again, like I said at the beginning, Medicare or insurances, if somebody's on a treatment track when they're on hospice, then that's a little bit of a red flag. So we just always want to help people navigate these things, but it's very individualized. So we always ask, just let us know, and let us know what questions that we can ask for you or that we can clarify for you. That's part of what we do is we meet with people sometimes more than once just to go over their specific circumstances and answer those questions. And then maybe you want to meet again later down the road and have other family members there. So just however we can be of assistance, we're happy to do that.
Another piece for hospice, specific to Faith Hospice, there are other hospices that have their own inpatient units, but not very many of them. We have one, it's called Trillium Woods, and there's a couple of different benefits that our patients can use Trillium Woods or stay at Trillium Woods. I did want to provide some clarification. I know a lot of people know that Trillium Woods is part of Faith Hospice, and sometimes they think, great, if we're on Faith Hospice and things get too hard, we can go to Trillium Woods and it's covered under the benefit. And that's not necessarily true. There are some different levels of care at Trillium Woods. Some of them are covered by insurance, some of them aren't. And so a couple of those that are usually covered by insurance is something called a respite stay. And that's a benefit to the family. Like I had mentioned before, the family ends up being the primary caregiver for the patient, and that can be really exhausting. So the respite benefits for those primary caregivers to have a bit of a break every month or so, where their loved one or the patient can go to Trillium Woods for about 5 days and then go back home. And the primary caregivers are able to get a little bit of rest and recuperate a little bit during that time. So that's typically covered by insurance. Another level of care is an inpatient stay. And the whole focus of hospice is helping with that symptom management, helping to keep somebody comfortable. Sometimes that can be really challenging in a home-based setting where you don't have access to everything that a hospital might have or even a facility might have. So when the nurse and the doctor will do everything they can to help manage a symptom, sometimes you need a little bit more. So a lot of times hospices, well, insurances for people on hospice will pay for an inpatient stay with the goal of getting those symptoms managed and back under control. And so that stay while you're there getting that symptom managed better is typically covered under insurance too. Now, the one level of care that's not usually covered by insurance is just a routine, they might call it a routine stay or long-term care, sometimes it's referred to as, and that's basically a patient or a family deciding to have the patient stay there for personal cares. They have their own room there, and that's something that typically is paid for out of pocket. So that's one distinction I like to make, just so people don't have that misunderstanding that, hey, when things get really hard, we can just go to Trillium Woods. You can, but there might be a cost involved to that. And again, that's a great conversation to have with your nurse, with the social worker on exactly what that would look like. But it's a huge benefit to have your own inpatient unit connected to the hospice service that you provide.
So hospice is a philosophy of care, and when Medicare made a hospice benefit, then different companies came into play to provide that benefit, and in many ways then are reimbursed by Medicare, or like I said earlier, private insurances. So you might be asking, why Faith Hospice? Why would I pick Faith Hospice over other hospices? Um, you do have lots of options with hospice, and we recognize that. Um, Faith Hospice is part of Christian Living Services. We have strong leadership. We have high standards of care. We have a good reputation. And that leadership, strength, and services through Christian Living Services um, helps and infiltrates all of what Faith Hospice is and does. We have a strong Christian mission and value system. That's part of who we are. But as Ben mentioned earlier, we serve out of that mission. Our goal is not to convert somebody or have them become Christians. We serve people of all faiths, all value systems, all races. And again, like I said, we serve out of that. So that heart of service is there. And I know Ben and I and our other managers, when we interview somebody for any open spot that we have here, we really are looking for what we call the hospice heart, or that heart of service. Hospice, or taking care of a loved one at end of life, it's hard. It's emotionally draining. And most people do hospice because they feel led to do hospice. And it can't just be a job, or you won't last very long. Ben mentioned Trillium Woods. That's a huge benefit for our Faith Hospice patients. We have the only freestanding hospice inpatient unit here in the Grand Rapids area. Others might have a section of a facility that they use. And anyway, we're very much pleased to be able to provide that benefit for our patients and family. The final thing too then is physician involvement. We have over 7 providers that help provide care for our patients. They do home visits. They meet very actively with the other members of the team, the nurse and chaplain, social workers, and the aides. They talk through the issues. They help coordinate and provide leadership to that team. But they also do home visits. We want every person new to Faith Hospice to have a physician visit, and then ongoing as there are concerns. We want the physicians to be involved, and that's a huge benefit, which is not required under that Medicare benefit.
I think the last thing we wanted to end with, after providing you all the information on hospice, well, maybe not all of it, but a good starting point, is that hospice is your choice. It's the patient's choice, or if their family is that patient's decision maker, it's that family's choice. And a lot of times the patient and the family make that choice together, depending on where they're at in that disease process, and where they're at, not only physically, like Tammy Sue had mentioned, but emotionally too. And so it's your choice on whether or not hospice is the right fit for you. So palliative care can be a great option for those who want to stick with a curative or a more aggressive approach to their care, and that's okay. I do think that if that's your choice to make, you should probably get involved with a good palliative care team to help maintain or improve your quality of life while you do that. But if you're at that point where treatment's not effective anymore, maybe it's not available, or maybe you're just worn out in that disease process, hospice is a great option with a lot of really good benefits. One thing I like to let family members know too, and patients as well, is that you're not locked into that choice if you do sign the papers to enroll into hospice. It's your right to sign off of hospice if for any reason you change your mind. So not a lot of our patients end up making that choice, but that doesn't mean it's not good to hear and to know that it's a difficult decision to make. So what if I change my mind? You do have that right to change your mind if you want. Tammy Sue and I did our best to kind of cover hospice in about 30 minutes or less. So I don't know if that's a good thing. I don't know if we answered a lot of questions you might have, or maybe you have even more questions now than when we had started this presentation. But if you do, our main number is on the phone here, or sorry, our main phone number is on the slide here at 616-235-5100. So you're more than welcome to give that number a call. Like Tammy Sue had said, the staff that we have really have a heart of service. They're not going to mind answering the questions that you have. A lot of times what we do is we have a social worker or a chaplain. Sometimes even one of our nurses go out to the home to provide what we call an informational about hospice. It's typically longer than 30 minutes. Sometimes it's right around 30 minutes. But it's great to be able to then have a dialogue with somebody and ask questions that you might have while that person is there with you in your home. Tammy Sue, I think that's all I had. I didn't know if you had anything else to add.
I don't think so. Sounds great.
All right. Well, thanks everybody. And we hope that it was helpful.
Thank you.